Would you be able to recognize the signs of a stroke and know what to do? I'm Fara Sax, and this is the Community Voice. A nurse practitioner and a young mother, Nikki. She suffered a stroke just days after giving birth to her second child. She shares her beautiful, powerful journey back to normalcy, I would assume. Also joining us is Dr. Mehta. He is the Director of Neurointerventional Surgery at Memorial Healthcare System. Together, they are raising awareness for Stroke Month in partnership with the American Heart Association. Thank you both for joining me today, and I'm just so blessed to have Nikki with me and with Dr. Mehta, who is the doctor who saved Nikki's life. Amazing story. Nikki, let's start with you. Talk about your journey. Talk about what happened that night after giving birth 3 days later.
Yes. So as you said, we had been home. It was our second night home. So obviously, as we all know, I was in and out of sleep. It was about, I believe I woke up around 1 in the morning, 1:30 in the morning. And it woke me up what I guess you could call it a headache, but from someone who has suffered headaches, here and there throughout my life, there was something different about it. It was quite paralyzing is what I use to describe it. I almost couldn't really think clearly. I couldn't move my neck. And I just knew that it was not a normal headache. But then at the same time, you're thinking, well, I'm postpartum. Could it be? But basically, I just woke up and told I woke my husband up and said, just call 911, baby. And he looked at me. Being in the field, I don't usually rush to get help, which I guess is one thing that this has opened my eyes to. But I usually don't, I'm not quick to pull alarms or to panic. So my husband thought it was very odd, but he called 911. And I contemplated for like a second, do I take Tylenol? I didn't even take Tylenol. I just knew I needed help. So he called 911. Luckily, it was, like I said, about almost 2 in the morning. So they got there very quickly. It felt like an eternity, but they got there super quickly. It was also COVID. We were still under all COVID protocols. So
this was about 4 years ago?
This was, yes. My son's about to be 4 in August. So yeah, almost 4 years ago. So my husband couldn't come to the hospital, obviously, but I was also leaving the house with a 2-day-old and a 2-year-old. So it was probably better. The ambulance just kind of took me away. I don't remember too much I remember loading the ambulance, getting in the ambulance. I remember kind of waving goodbye and telling him I'll be back. But I don't remember too much more after that. But that's kind of what happened, that I just woke up and my instinct just told me, call for help quick. And thankfully I did.
And you're in the field, you deal with children that have cancer.
Yes.
And so you're not an alarmist. So you really knew something was different.
Right. And I think that's part of this, my learning from this is sometimes you just have to trust your gut and err on the side of precaution. I remember telling myself, maybe it is just a hormonal migraine, right? And in the end, great, I'll come back home. But I figured, because, you do start to think, even though I was pretty paralyzed, the pain was pretty substantial. But I remember thinking, like, am I being crazy? Am I being dramatic? Am I just being hormonal? And I think that this is worse. And of course, the last thing I want to do, I'm also thinking who's going to feed the baby, because I was breastfeeding and so much was going through my head. But luckily, I just sounded the alarm. And then from there, the healthcare team took care of the rest.
Talk about that journey. Dr. Mehta walks in and he's the doctor on call for you. So tell me a little bit about what that journey, what happened after when you got to the hospital, how you recovered. Talk about that sequence of getting back to who Nikki is.
Right. So along the same lines of why it was so important, I guess, to call so quickly, was I actually lost consciousness in the ambulance in my neighborhood. So it was within minutes of them loading me into the ambulance. So I did lose consciousness. I know I was intubated in the truck, and basically everything else I learned through reading Dr. Mehta's notes. He obviously would walk me through it, but I don't remember much while I was there. I was there about 3 weeks in the ICU. I know I was taken to, so I live in Broward. So I was taken to Memorial West, where they quickly, Dr. Mehta can speak more to this, but I think also the importance is is trusting and valuing the healthcare team, right? Because I know they did do some steps. They were able to place some drains. And I truly believe that the reason I don't have that much residual damage is because of how quickly that blood was removed from my brain, right? To not cause further damage. But so they were able to stabilize me. And I think those first steps that they did there were crucial, I think. And then they got me over to Dr. Mehta, who was at Memorial Regional. From there, he operated and he did his magic. And I don't remember much at all about the 3 weeks. I kind of just remember going home. But I did walk out. I walked out. I never went to therapy. I never did physical therapy. I never did OT. I never did anything. I was prepared to have to do all that. But luckily, I was just very blessed that I walked out. And just over time, yeah, there was a recovery phase, more, just mentally and having patience with myself and kind of getting back to normal. But yeah, I just kind of walked out and started the recovery life.
Mm. Dr. Mehta, thank you so much. And to have Nikki here with us is truly a blessing for the quick response that you and your team put together to make this happen, and for her to tell her story today, especially now during Stroke Month through the American Heart Association connection and relationship. Did Nikki's case present as a normal stroke situation? Is this how she's a young woman, 31 years old at that time, to have gone through something so intense and so life-changing and could be altering and even tragic?
That's a great question, and thank you for having me here today. Nikki, I think as you were recounting, the moments before the detection upon arrival to the hospital of what was going on in the brain. I think we still all, as a care team here at Memorial, recall vividly everything that you went through, and so I don't think any of us will ever forget. So to your question about kind of the classic signs that Nikki experienced, I think it's important to emphasize, especially now, during Stroke Month, that there are two different types of strokes, that are classified as either the ischemic stroke or the hemorrhagic stroke. So, those are technical terms, but in layman's, kind of explanation is that an ischemic stroke is due to a blood clot of an artery, blockage of an artery in the brain, similar to like a heart attack, blockage of a coronary artery in the heart muscle. And so that deprives the brain, the moment that it happens, of, blood flow beyond it and the oxygen, the nutrients that the brain needs for the neurons to survive. And so that accounts for about close to 85% of all strokes. Okay. And, with the approximately 800,000 strokes in the US, the remaining 15% or so are the hemorrhagic type. And those tend to be sometimes more devastating. And that's what Nikki had experienced, is the hemorrhagic stroke. And that's, basically bleeding into the brain. So instead of blockage of a blood vessel causing an ischemic stroke, hemorrhagic stroke is due to, high blood pressure that causes the, blood vessels in the brain to leak and cause bleeding, or an aneurysm, which is like a bubble within a blood vessel due to inherent weakness in the wall of the artery. And, imagine like a balloon, you fill it with water. If the pressure gets super high, it can burst unpredictably. So that's the same thing with an aneurysm. And that's precisely what Nikki experienced, is a ruptured brain aneurysm. There are other causes of bleeding, such as arteriovenous malformations, and those are kind of bundle of blood vessels in the brain, kind of like a pressure cooker, and all of a sudden it can burst as well. So when Nikki arrived, here at Memorial, we promptly did a CT scan. So that's the initial workup that all stroke patients or suspected stroke patients undergo. And that's when we found extensive bleeding particularly in the back of the brain. So the next step is to do some form of vessel imaging. I always describe this, and the way I explain it to Nikki and her family is kind of like plumbing 101, right? You want to see what exactly is wrong, in the brain that's causing this bleeding. What's the source? Identify it, and then repair it, try to treat it promptly. So that's what we ended up doing in the, urgent, emergent situation when she first arrived. So her aneurysm was in the back of the brain, and it's one of the, so most precious real estate areas of the brain, called, the brainstem, the cerebellum area. So the brainstem is what keeps us awake, alert, alive, our level of consciousness. So her aneurysm was located very close to the main blood supply that supplies the brainstem and the cerebellum. So, the rate of mortality, meaning death from an aneurysm in this location, is very, very high. It's among the highest of any aneurysms, that burst in the brain, among the different locations. So thankfully, with the team we have available here, and Nikki initially had a drain placed, as she mentioned earlier, to uh, emergently lower the high pressure in the brain. And then it bought us some time to do our treatments in the cath lab to fully secure the aneurysm so that it wouldn't burst again. And during that workup, we also found that she had, unfortunately, a second unruptured aneurysm in the front of the brain. So after she made that initial recovery, we were able to get her back in and treat the other aneurysm.
Do you ever sometimes say to yourself, Dr. Mehta, afterwards, this was a miracle? It sounded like there was a miracle, a serendipitous miracle that Nikki is here with us today. And thank God, mother of two, she gets to enjoy her children for years to come. What saved her life? Early
Yes,
intervention?
absolutely. I do think it is a miracle, though, because the data, the statistics show, from the Brain Aneurysm Foundation, American Heart Stroke Association, that when a person experiences a ruptured brain aneurysm, about 40, close to 50% of patients that experience this out of hospital, meaning at home or at work, they don't even survive to the hospital because of the immediate high pressure in the brain that causes them to lose consciousness, progress to a comatose state. And so it's the, quickness of the paramedics when they called 911. So I think that first main kind of decision point is what Nikki and her family did, actually, is recognizing that, strokes come in many different forms. And so, we always emphasize, such as, the FAST acronym for the ischemic type of strokes, right? As we were discussing earlier, blockage of a blood vessel in the brain due to a clot, face, arm, speech, and time. It's also important to know the symptoms associated with the bleeding in the brain, such as from a ruptured aneurysm, is the worst headache of a person's life, nausea, vomiting, neck stiffness, and, progressive decrease in level of alertness. And so when she knew that, okay, this is not just, some migraine, not to sleep it off more, that, they rush to the hospital. And so we've done a lot of work with paramedics in our community here at Memorial to make sure that they also, when the dispatch notifies them about, patients with these type of symptoms, that always call in as a stroke alert because they're now aware of the signs and symptoms for brain aneurysm rupture, and to allow us to, mobilize our cath lab as quickly as possible so that the patients can have the best outcomes. But at the end of the day, we see, unfortunately, quite a number of patients on an annual basis with ruptured aneurysms, and the cards are always stacked against them. So it's absolutely a miracle.
Absolutely. Let's talk about that. You alluded to the FAST acronym and FAST. Let's talk about that and the importance if someone is witnessing or experiencing this, presenting these symptoms? Let's talk about that. The FAST, fast.
Any sudden uh, onset of facial weakness, droopiness of the face. It's usually recognized by family members, loved ones, coworkers. So, 1 minute, if they have a symmetric smile or when they're talking, and then a split second later, all of a sudden, the one side or the other of the face is droopy. That, also can go along with slurring of the speech because it's all the same so facial muscles responsible for, appropriately enunciating our words and making sure that we're coherent. And so, the arm is if,
The
person,
A.
uh, yes, the A is for, arm weakness. So, if they're holding a cup of coffee or writing and all of a sudden they drop whatever they're doing, the arm kind of just slumps down. That could also be, uh, sort of initial warning sign that this could be a severe stroke. And then the S stands for speech. So beyond just slurring of one's words, its inability to get even any words out. So becoming completely mute or having trouble understanding what others may be saying. So there's always two components for speech, right? So it's the expressive component, our ability to produce speech, but also comprehension of speech. And those are done by the different language areas of the brain. And so if either of those are affected, that's the S part of FAST acronym is the speech. And then time is of essence. So immediately call 911. We know that for every minute that elapses, about 1.9 million neurons are at risk for irreversible injury. And so you can imagine, if a stroke happens to a much older patient, Nikki is also, very fortunate, in terms of her young age. She had more brain reserve in order to sort of rewire any potential areas. That's called brain plasticity. But as we age, we all experience that natural atrophy. And so if there is, delays in seeking treatment, we always say time is brain. The faster the blood vessel is opened up, the better the outcomes, right? And so every minute matters. And that's why, working with our paramedics, as well as a lot of process improvement that happens in the hospital is critical to achieving good outcomes, both for, the blockages, the clots in the brain, as well as issues like ruptured aneurysms. It's something we emphasize every time we go out into the community, work with our paramedics at the EMS stations, and now paramedics all throughout Broward and, much of Miami-Dade have the, ability to FaceTime us whenever they encounter a suspected stroke patient in the field. And if they're not sure, similar to what Nikki was mentioning, that, okay, is this just a normal headache or maybe just a one-off, or should I take this seriously? Paramedics, especially junior medics or those who may not have seen potential strokes in the field, they have the same questions. So a lot of the education that we've done over the past 10, 12 years has been going out to the stations and teaching them signs and symptoms of stroke, how to assess a patient in the field, and then when calling in a stroke alert, what are the pertinent information that we need, and then to FaceTime me if they have any questions, and we quickly lay our eyes on the patient in the ambulance and tell them, yes, you're on the right track. Keep, just stabilizing the patient, monitor their vital signs, and it gives us sufficient lead time to activate the cath lab.
Absolutely. And thank God for the American Stroke Association, who gave credence to this fast track for recognition of these symptoms. Let's talk a little bit about the risk factors for stroke. And did Nikki present as having
A
any of
great
these high
question. So
risks?
some of the screening, battery of tests questions that we ask is, at least in terms of the hemorrhagic stroke component, right? The bleeding in the brain, that part, category of stroke. We worry about high blood pressure, smoking, family history of brain aneurysms. And so, unfortunately, or, in terms of Nikki's case, she did not have any of those risk factors. And it really goes to show that, because aneurysms are so common, and many times we don't know who will, harbor an aneurysm and they may not even know it. Half the patients we see in the emergency department or in my office are those that are just found incidentally during workup of, very vague neurological symptoms. And then we get vessel imaging, such as a CT arteriogram or MRA, and then lo and behold, there's an aneurysm. So in
But
Nikki's
can but
case, she was
just
previously healthy.
but just yes, if she even if she had an aneurysm presenting, does it mean that it's going to erupt? Is it going to be problematic? Is it going to worsen? Because you found a secondary problem with Nikki that was still hiding in the corners that didn't react.
Correct. So, because we know the, downstream adverse effects if an aneurysm were to rupture spontaneously, we take it very seriously that if a patient, typically younger than age 75, 80 years of age, has an unruptured incidental aneurysm, based on its size, location, and if they have other risk factors like a strong family history,
Mhm.
high blood pressure that may be uncontrolled, we almost always offer treatment, especially if their estimated survival, is expected to be at least 5 to 10 years. And so, the thing that we cannot predict, despite a lot of epidemiological studies on brain aneurysms, is who may experience a rupture during their lifetime and be able to accurately stratify it, is still, unfortunately, many times a guessing game.
And do certain populations have a higher risk? Blacks, Hispanics, are they at higher risk for developing symptoms and having um,
So specifically for ischemic strokes, the tendency to form blood clots that may go to the brain, those populations that you mentioned do have a higher risk. And a lot of research is being done by the American Heart Stroke Association as to figure out why those subset of population, the Hispanic, African American community are at higher risk. Sometimes it has been linked with socioeconomic factors as well. Access to healthcare is important, preventative care. So, we always, similar to heart disease, it's the same risk factors that we want to control in terms of prevention of an ischemic stroke, right? And so that's beyond high blood pressure and smoking cessation is managing cholesterol, diabetes, being compliant with the medications if you have those issues. Obesity is another major risk factor, and lifestyle modification, doing what's in our control in terms of eating a healthy diet and getting regular exercise.
and we're sitting in stroke month, but it's a 24-hour, 12 months lifetime journey for Nikki and for you, Dr. Mehta. Nikki, what message of hope do you have for women or men that are going through this, as you as a young mother with young children, and what have you learned from this experience that you could share with the community that could help move them forward, whether it be recognition of signs or those that have experienced the stroke, words of wisdom?
Well, I'm sure I could come up with quite a bit, but I think the take home for me has been, yes, definitely that I always question, what if I had just taken the Tylenol? Or, with migraine history, my ice packs do miracles for me sometimes. So what if I just put the ice pack on? I was so tired, I may have just fallen back asleep. And so I think
So you've had migraines before.
I had nothing crazy out of this world, but yes, I had headaches or migraines in the past, and I knew that Tylenol and ice on my head usually worked. So, it sits with me a bit, just thinking, knowing what I know now, which is that really I was saved by minutes because, as much as my husband, I'm sure, would have tried to save me if I had lost consciousness 10 minutes prior to when I did, I think there would be a very different, we know there would be a very different outcome. So I just think to myself, I guess one take home is maybe Tylenol and ice would have helped, but you're better off telling the paramedics, you know what, never mind, I feel better. Because I think sometimes people too are nervous to call for help because what if it's nothing, then I'm going to look silly, or, what they're going to think I over exaggerated. So I think you're better off. In hindsight, I was better off. I could have just told the paramedic if it had been the case. I could have said, look, I feel better now. My Tylenol worked, my ice worked, and then paramedics will never get upset. They'll be happy and go along with their, shift. So I think one message is just raise the flags and call for help. And then in the end, hopefully you don't need it. But if you need it, it's already on the way. So that's one thing that kind of sits with me still to this day. Recovery wise, I think just to have patience with yourself. I'm now almost 4 years out, so I've come a long way. It was difficult for me to even have this. I don't know that I could have had this conversation a couple years ago. More just so in one way, it's easier for me to cope, but it's also I find myself as time goes on struggling a little more with just the what ifs, right? So like my kids are now 6 and almost 4, so every little thing they experience and every stage I go through, I'm like daunted with this feeling of what if I hadn't been here? Like, what if I missed this? So just to have patience with yourself. Sorry.
No, but this is the important this is the important moment. This is the important message that it's not just a physiological rehabilitation, it's an emotional.
Right. I think in my journey, at least, and I know I do not speak for I think the most common, the rehabilitation and the recovery can be very different for everybody. I was so blessed that I cannot say I struggled much. I'm sure I struggled plenty in the hospital, but from what I remember from going home, I did not struggle too much physically. And so I'm very grateful for that. But yes, emotionally and mentally, I think for survivors to just have patience with themselves. Because sometimes I think to myself, well, maybe I'm just anxious, right? So like any little thing now, and with my husband, to think about my husband is not the patient, but he was the man whose wife left, and he was told his chances were very slim to get me back, or at least to get me back in any sort of state that he would recognize, right? So he went through a lot, even though he wasn't the patient. And luckily, my kids were too little. So it doesn't seem like they bore many repercussions, but many families have older kids. So we all have to be patient with ourselves. My husband as well has a lot of PTSD. So I get a little headache because of anything. And I have to realize, oh my goodness, he's very nervous right now. So I have to be like, babe, I know what it is. I didn't drink water, or I think it's this, or I think it's that. And sometimes we get a little more anxious than we probably used to. And then we remind ourselves it's okay. We know why we feel this way. So I think just to have patience with the emotional, mental part, because I think to myself, I should be getting less affected by this as time goes on. And sometimes it's the opposite. So I just remind myself and my whole family that we need to be patient and count our blessings. Obviously, we have no words for Dr. Mehta and his team, and we are very well aware that my entire life and the fact that I can now raise these children is thanks to them. And obviously the rescue, who obviously I firmly believe they're fast acting and their intubation skills, and it also is hope, or it's proof to the rescue personnel that their work is valuable, because even just a missed intubation that took an extra minute or two, I truly believe I would be a very different person if my intubation had taken any longer than it did. So yeah, I think that's what I would just say.
Dr. Mehta, what is it like for you to hear Nikki talk in her own words and talking about her finding her way back not only for herself but her family, her husband, and that PTSD is that what you're hearing for patients and families that go through these events and these situations?
I think I agree with everything that Nikki just mentioned. On the healthcare provider side, we don't always tend to appreciate, everything that patients and their families go through, perhaps because of the complexity of some of these diseases that we deal with on the hospital side. Sometimes we take it for granted, some of the technologies and advanced treatments that are provided and the outcomes that these therapies are able to achieve. But, there's definitely, as she mentioned, the emotional component, and, it goes, not just with the patient, but all the family members, spouses, kids, parents that are involved in caring for the patient, the loved one. And the follow-up care is also sometimes in the healthcare environment, because we're always limited with time. In clinic, it's very technical, focused on risk factor management, what we were just discussing, blood pressure, smoking cessation, things like that. And rarely do we get to sit and have a deeper conversation with the patient in terms of how they're feeling, right? And how has the recovery been from that end. So I'm glad Nikki had the opportunity to go over that today.
And and I want to thank you very much, both of you, for being Dr. Mehta and Nikki, to being here, sharing your story, and being her doctor, saving her, for we have this moment together. And I thank so much the American Heart Association for shining its light on Stroke Month, because every day we can do something. We can act fast with our FAST acronym, and make someone have a story that they can share with me and with their family for many, many years to come. And so thank you, both of you, for being here today and sharing yourselves with me. So thank you.
Thank you.
And I want to thank you for being with me today. I'm Fara Sax. Until next time, take care of yourselves and each other. Have a wonderful day.